Okay, so good morning, everybody. We're going to get going. We've got a tight schedule, so I know people are going to filter in as the day goes on. And so good morning, and welcome to our fourth annual, this is the part I always love because the title is so long, take a big breath, and fourth annual Georgian Bay Healthcare Wellness Research and Innovation Day. So welcome, everybody, and thank you for coming. We've got some live streaming, so that there's people that are online, and as the day goes on, usually the room kind of fills, and we have some overflow rooms and whatnot as well. This event is a great collaboration between the Collingwood General Marine Hospital, the Rural Ontario Medical Program, the Town of Collingwood, and Georgian College. A great example of partnerships in our community, partnerships in our educational system coming together and really putting on something great for our interprofessional providers as well as our community members. So some of our goals here today are to give you an opportunity to network, learn, and explore some of the great research and initiatives taking place in the southern Georgian Bay area, as well as provincially and internationally. Just a great opportunity for people to learn about some of the great ideas and innovative processes that are happening. And as you'll see outside the room, our community has come together to contribute over 40 posters outlining the great work that people are doing here in southern Georgian Bay. And if you look around at your fellow attendees, you'll see representatives from a wide range of organizations, as well as community members. And in your handout, you've been given 2 evaluation forms, and we kindly ask that you fill out these at the end of all presentations today to let us know how the day went. We are just extremely excited that you're all able to join us, and I want to thank those who are able to make it in person today, and again, in addition to those that are live streaming as well. Some housekeeping, so please help yourself to refreshments, which are available just outside of in the cafeteria over here. And there'll be opportunities to ask questions after each speaker, but we may try to move this along in order to stick to our schedule. We've got a lot of speakers and crisp timelines as well to try to ensure that we get everybody having the opportunity to parlay their thoughts, and also for those in the audience to ask their questions. In addition, we've got those posters that are on the walls. You'll have opportunities to review these at around 10:30ish or so, or just before 10:30, and then as well around just around 12:30 or so, and then they'll be up in the hallways probably for the next few days. So this is the 4th annual event. This year's focus is on cancer, and according to Stats Can, 1 in 2 Canadians are expected to be diagnosed with cancer at some point in their lifetime. And the rate of individuals surviving 5 years beyond their cancer diagnosis is increasing, with an overall decline in cancer mortality rates. And a great segue into having our members come here to talk about some of the innovations and some of their experiences and some of the work that's ongoing. I'd like to introduce Michelle Hunter. Again, Michelle is extremely important in setting up these events. I want to thank her for her involvement, and she's going to give some opening words on behalf of the Rural Ontario Medical Program.
Welcome to the 4th Annual Georgian Bay Research and Innovation Day. What a privilege it is to be a partner with CGMH, the Town of Collingwood, and Georgian College in presenting this event. The Rural Ontario Medical Program provides training and education for medical students and residents and other healthcare providers in rural Ontario. And this Research Day is our opportunity to highlight the important healthcare quality improvement and innovation that takes place in a rural setting, in a small community, and to develop this as a model for other communities across the province and Canada. We have discovered, however, there is an infection in this community and in this organization here, and it's very contagious, so you should all beware. Although I think you already have the symptoms of that, it's excitement and enthusiasm for the diagnosis of quality improvement and making changes and your interest to innovate. And as the students and residents come through this site, they really give us the feedback that says there is nothing like South Georgian Bay. And so we really want to do a special thank you to all of the teachers, the healthcare practitioners, patients and volunteers, and really all these community committed members that really support all of the training and education. And really, Dr. Lisi, thank you for your most infectious leadership and continuing the momentum of innovation. And to the students who are a large team that put today's event on, so thank you very much.
So our other intro, I'd like to introduce Dr. Jacqueline Limoges. She's a professor from Georgian College, and she's also going to say some opening remarks. So.
Good morning and welcome. Georgian College is really pleased to partner with the Collingwood Hospital for today's event. It's these kinds of initiatives that really help us to build a community of learners, and it really is what makes our communities thrive. Georgian is also really proud of the education programs that we offer to prepare health professionals to assist people as they move through various stages of health, including through the diagnosis and treatment of cancer. Dr. Lisi mentioned a little bit about some of the progress that's being made around cancer treatment and cancer outcomes. And Georgian is really committed to evidence-based practice and to supporting research. And one of the things that the college does is that it supports me to sit as the vice chair of the Ontario Cancer Research Ethics Board, another role that I hold. It might be comforting to many of you to know that the Ontario Cancer Research Ethics Board exists. So before any cancer research is offered to cancer patients, to real people, cancer research undergoes an ethical review. And it might also be comforting for you to know that there are two people from our region who sit on that board, myself as the vice chair and Dr. Jason Wu, who is a medical oncologist at RVH. So OCREB does really important work for advancing science and making sure that it's ethical. So two big parts that Georgian plays in the role of cancer treatment. So as I see a lot of the science emerging through my work with OCREB and my teaching of nursing, and I can tell you that today's program is really exciting and innovative, and you'll have a really good sense of the kinds of things that are happening to advance cancer diagnosis and treatment. So again, welcome, and I hope you enjoy the day.
Great, thank you so much. And just before we also get started, I want to thank a few individuals who helped make today happen. From our partners, we have Martin Ridlow from the town of Collingwood. I saw him in here, as well as Peter Wells, Michelle Hunter, Cindy Griffiths from Georgian College, and our team here at CGMH. So thank you to those individuals who've all come together to make this happen again.